This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Hello, Dr. Amber Beckenhauer. It's so nice to see you again live time.
Yes, absolutely. I feel like I'm in California right now with this break on the background.
Had to bring the Calibraska part today. So super excited. And, we'll get into it a little bit later, but it has been such a wonderful year being back in person for certain events. And especially you and I, sisters from different misters, got to spend time physically in the same space for multiple days. And it was just such a treat just to see you live time. It's always a treat.
Mm-hmm.
And so I'm super excited to talk with you.
This little gal right here got stuck with me in a car for about 3 hours coming back from Kansas City. We spent DPC Summit together, right? And we got to talk on stage and enjoy each other and all of our other colleagues. And then Maryal came back with me to Nebraska to check out our brick and mortar locations in Ashland and Blair. She did some patient appointments while she was here, learned from our nurses and from myself, and got to meet our PA. So it was a really good time. And over this year, you've been a lot of places, right? You went from doing only podcasts and being on the phone with your patients to now you have your new location open, right? Just in the last couple of weeks.
Just in the last couple of weeks. It's a perfect time to, I feel, do this interview because having a space after not having a space for a little over a year, it really brings a different perspective, and also seeing your clinics. And Dr. Beckenhauer did say locations, plural, because she has 3 amazing locations. Mm-hmm. And seeing those spaces, and the number of DPCs that I've seen in person is very few, unfortunately, up to this point. I've seen Dr. Janine Rodham's office, I've seen your offices, and it's just it's a different feel. It's not a good or bad thing in any sense, but it is such a different feel. And for me, it was very inspiring to have, I still think of the day that I saw Dr. Rodham's office by appointment only was office availability. And for your office, it was so cool to see how you interacted with your patients, with your staff in a physical location. And so it is true. In October, I opened up Big Trees MD, a physical space, and I've seen about 4 patients of my own practice in the location. And then I actually ran a free flu clinic for the community. So I'm working with the local public health department to bring clinics like this to our community and to have a physical space where people can see, oh, there's actually a medical clinic here in Arnold. This is amazing. I didn't know this existed. It definitely was a way for me to share with the community that I existed, but also just to hear the feedback of like, oh my goodness, I couldn't get down the hill 30 minutes to get my flu shot before they closed. And I don't get off of work until, all those stories. And so just really being a community-based physician now with a community-based physical space, it definitely brings a different layer to Big Trees MD.
What would you say are the biggest pros and cons? I mean, you interview all these people for, at least over even the last year. And every day you're just thinking about, in your mind, what would my office look like? When is this going to happen? When you put those things into perspective and drive around to IKEA and Target and everywhere else, get all your decor. I mean, what do you think was your biggest perk or your favorite thing about opening that office or getting down to that moment?
Those are great questions. I would say that for me, one, I am blessed in that like I can drive to IKEA because some of my dear friends cannot easily drive to IKEA and Target, for that matter. But for me, what I was able to do, just like I did when I even opened my DPC, was I was able to pull from the experiences of so many who have gone before, just like yourself, in terms of, things to look out for in leases, ways to think about your space so that it's most efficient and keeping overhead as low as possible, ways to think about, okay, if I get a space, then what does that entail in terms of renter's insurance, et cetera. And so for me, one of the biggest impactors, I think, on me in that space in getting an actual physical space was Dr. John Jacobson, who's, your neighbor in Nebraska, when he said, and people can go back and listen to his episode, he had said the quote of, why buy what you can rent, why rent what you can steal? And I didn't get to the stealing part, but I do feel that in terms of the rental and the shortest term lease that I can negotiate, I was very thankful to find a space that was in the heart of where my ideal practice would be. In terms of my town, it's not that big. We're along a highway, one lane in each direction, but my location is across from the fire station, and I'm working with the fire department to do services for them over this next year.
That's
including
awesome.
like just doing flu clinics. Like they can't easily get to do flu clinics or get to flu clinic locations. I'm across from the Ace Hardware, so if I needed something, that's there. I'm walking distance to the post office, to the library, to the school, to Giant Burger, which is the only burger joint in Arnold, California. So I feel that the location is great. And I had thought of location on top of terms of lease. And in terms of my term of lease, I was very, very grateful to have the confidence to say, look, I am looking for a place, but I would like to try the place out first. And so what I did was I negotiated for a 6-month lease with a 3-year option after that. So for me, it was like, great. I haven't installed anything in terms of doing a build out. I strategically said, okay, the way my office is set up is that there are 2 floors, 2 bathrooms that are upstairs. And then I have a clinical space and like a waiting room area on the bottom. And so my space is about 1,300 square feet. And my strategy, because we live at 4,000 feet, was to have the heat be really isolated to the exam room where I see patients. And so that would save me on electricity. I have a 6-month lease to find out what would my overhead cost be for my location. My renter's insurance was like less than $500 for the entire year, which in, a high fire area I was grateful for. And so I just feel that, getting back to your question, pulling from other people's experiences, Dr. John Jacobson, what other people had shared about their own leases and their own experiences and having a space really helped me just quickly get into, once I found a space, these are the furnishings that I do and do not need. And I will drop an amazing story here. I totally believe in, the idea of good juju. And so for me, the story of my exam table is an amazing one. So I had been on the lookout for a table for a very long time. Just, I was ready to store something if the price was right, if the timing worked out, but I couldn't find anything. And then literally, I think 2 weeks before my lease was to start, I had found on Facebook Marketplace a physician in Napa who was giving her table for free. And I said, so like, is it really truly for free? Because sometimes people put free on Marketplace and then it's actually like $149.99 that they put free for, to bait you. And so
Typical
it was completely
Maryal
free.
moment.
Yeah.
You can find about anybody anywhere and have a story from it, right?
This is true. This is so
This is
true.
true.
This is so true.
I mean, come on, we're standing in Omaha and this girl in that parking lot when I'm doing Botox injections for research, you're like, oh, I know you from Facebook. And I'm like, this is really happening.
Oh my goodness.
From California, and you know this doctor standing in this parking lot.
Yeah,
like,
it was
Total
That
you,
was,
total you. And this is how this exam table went down, right?
yeah, this is so true. And just some backstory there. Dr. Beckenhauer had to go to a I don't know what you would call it, like a side gig type of
Yeah,
situation.
moonlighting. I helped do Botox injections for a research company,
Yep. Yep.
for one of the research studies. And I had to train this doctor that day on injecting for this study. And as we're walking out to meet Maryal, and this is our typical life, Dr. Concepcion's life with Dr. Beckenhauer. Here we go. So she's waiting for me in the parking lot as she has shopped 3 bags full at World Market. Or no, sorry, it wasn't World Market. It wasn't World Market. Darn it. What's the name
Whole
of it?
Foods.
The Whole Foods. Thank you. Not World Market. Whole Foods. She's got fines for my kids, fines for her kids. Not really sure even how she's going to fly back with everything she has. She's waiting in my car for me. And I walk out with this doctor. I introduce them. And then pretty soon it's like, wait a second, don't you have a podcast? And aren't you so-and-so? And I'm like, really, is this really happening right now? It's
so random.
This is how the exam story goes down though, with your table. So
It totally does. It totally does.
All the different lives and all the dots that connect, and it doesn't matter where you're at, Cali, Nebraska, or where you are, but.
Yeah, it's so true. And so for this amazing story, what had happened was, so I find this table offering on Facebook and it says free. And so I'm like, oh, this is great. It does not look like it's destroyed. I don't have to reupholster it. It looks perfect. So Napa is about 3 hours away. And so I contact the doctor and she's like, hey, just call me and we'll talk about it. So we ended up talking for about an hour. It's Dr. Amy Burkhart, who is in Napa, California. And she, for everyone, is a tremendous celiac expert. And so I'm just going to drop her website. It is theceliacmd.com. She is a wonderful human being. And she had ironically been practicing insurance-free medicine for, I believe, 12 years is what she told me. And so she had no idea about direct primary care. She had no idea that people were doing this under a membership model. And it was just, you know how that happens when you tell someone about DPC, especially another physician, especially one who's not been taking insurance for her career. And then the conversation just continues. And so it was such a cool thing to have that person be the person where this table came from. And so there was a company, I will drop another company name that I had no idea about. I don't know where it's located, but for me, Lugg, Lugg, was an app that I used where it's like an Uber for moving. I just put in, this is the item that I need moved. This is where it's going to and from. And then magically it appeared in Arnold, California on the day it was supposed to arrive. And so
my favorite was like, though, when you were saying, I didn't really know if it was going to show up. I just had the hope that it would. My table might be arriving today. It may not be. I'm like, this girl, she will do anything. It just
absolutely. And I was like, well, technically it's free, but the move was like, around $400. And so that was pretty amazing for me to not have to drive, pick it up, drive back, unload it. And yes, that is very true. I had this like, does this actually work type of feeling that you and I talked about.
Show up, I may not.
Yeah, this is true. And so thankfully I have a table. It's been with 4 patients already. And it's been great. But yeah, I think that for me, my space allows me to have an exam room for, whatever I need for regular family medicine stuff, but also to have that non-traditional office. I will post pictures of my office in the blog.
Pictures?
Yeah, absolutely. Okay. But for my waiting room type area, I have a measure mat that, I can measure kids and do exams, watch them move around, do, the general doctor thing without having to be in a doctor's room, because I have this whole waiting area that really technically is an exam space because I don't have more than one patient or family in the practice at one time for, regular family practice hours. And so I think that is also something that I haven't been able to do easily and ever in a clinic space. It's always been bringing your kid into the exam room, especially when I was in fee-for-service. Let's have you wait, 45 minutes, hour and a half, and your kids are jumping off the tables and all the crazy things. And now it's like, I have a little tent that I popped up that has some fairy lights and kids. And I for me, listening to other people and hearing the stories about how kids use spaces, for me, it was even down to, I have textured pillows of all sorts of textures. So if a kid is, sensitive to something, that even the textures, they could potentially find something that soothes them or that they feel comfortable with. And I have this IKEA kids table with, the placemat type thing. It's like an ocean scene where kids can scribble. And so it's been great too, that like Asher will say, Mom, can we go to your office after school? So I pick him up and he's drawing with the crayons at the table, and now he can read in the tent and his brother can later on. And so I think that it's a very different layer of the practice again. And then upstairs, I envision a lot of possibilities. I don't know what it's going to look like, but I envision having a space also for things to happen that are community based. So envisioning working with the public health department to do public education classes on, dental health and kids or whatever it is. And then also I've reached out to our community college. I don't know what will come of it over this next year, but they currently do not have anyone providing health services. So, as a community-based physician doing direct primary care, I have the ability to say, this is how I want my life to be run in terms of the DPC portion. And this is the part of me that can do DPC/community. And this is the part of me that does community-based stuff. And that's on top of, family and entrepreneurial stuff. So it's been a great year, but the space really represents, I think, the expansion of possibilities in the practice.
Yeah. But the space and the community, in general, the importance of you being there is huge, right? Because you recently the boys were sick. And you think about what was and wasn't available in your location. Luckily, you're a doctor, right? And you have the capability of knowing who to call, what to do, having meds there at the practice. What about all these families that they don't have doctors in their family and you're the show in town, right?
Absolutely.
You and your husband. But,
yeah, this is true.
But honestly, your importance is huge in that space because it's such a drive to other locations.
It really is. And, it highlights the importance of physicians being able to practice in a model so that they don't leave medicine. And so the services aren't, eliminated completely, right? Because you are so right in that access to care these days, especially when we're rural, is so, so imperative to the health of the community. And so, for me, what Amber was talking about was that the boys got sick and I actually had to take my youngest to the emergency room because he had tachypnea. And you come to a point, at least for me, where I can't trust my doctor brain as a mom. And so, but yeah, I was texting the peds hospitalist because I have his number and I just needed to get an x-ray, but even to get an x-ray, it was 5 hours later. Could I have ultrasounded him? Sure. Could I have done an RSV and a COVID test because I have those rapid tests? Sure. But he had never been sick before. Like he was a COVID baby. And so he'd never practiced really getting sick before. And then this happened like 3 days into daycare. For the very first time, it was like, oh, there you go. Yeah. And, with you having
to help families in their situation at your clinic and have the tools that you do have.
Yeah.
That's going to be huge in your smaller community.
Yeah.
With that being said, even like when you were here in Nebraska and talking to other physicians through the podcast, is there anything that really prompts you to want to have available for services or even tools or medical equipment in your practice that you've really just kind of decided, okay, we need this here, or we have to have this, even talking through some of these conversations with the other physicians?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code Maryal20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yeah, and definitely that's been like, I think I alluded to it last year also, that like I really would like to have a space to offer community services that are separate from my regular membership. And so things like weekend circumcision clinics, like literally just the availability of a family to get to a clinic, it is a huge thing over here. And doing things like skin cancer screening, dermatology procedures, because people can't get access. I mean, like basic things like that, like flu clinic once a month or whatever it is, those ideas are definitely coming from, one, my community, but two, having talked to so many physicians about what they offer in their own communities. Like Dr. Vicky Borgia offers free sports physicals to her local schools. Amen. Like, why can't all of us do that? Oh, wait, we can do whatever the heck we want now.
Yeah. Oh gosh, I know. This Friday, we're having a free PRP clinic for Veterans Day. And you're exactly right. What you want to do, you can do. It's your clinic. And speaking of your clinic, balancing things, how has the last year been with the podcast really kind of exploding? It's definitely completely different than it was a year and a half ago, a year ago, right? And now you have this clinic that you have to open, and well, not have to, but you are at a point where you want to, but the boys are growing, right? Yeah. Trying to balance that too. And what does the last year look like with the podcast and balancing all that? And what do you foresee it turning into after this?
A great question. So I don't necessarily think the brick and mortar is adding in terms of time suck. I don't feel that at this point. And clearly I just opened the office, but what I feel is that it can actually be helpful.
Yeah.
I was talking
with
to
you spending time driving to all those places,
correct.
Right? So it definitely will add your time in your bank there.
Yes, absolutely. And I was talking to a pediatrician who does exclusively home visits, and she and I were talking about how doing home visits is definitely limiting her growth. And I can understand that and relate to that, because it's like, I get that, you can have Dr. Jalon Burton has a great way of, in the DMV area, that's the DC, Maryland, Virginia area, that she has, on this day, I go to this area. And while that's probably the best and smartest way to do things, I tend to find myself spending longer at home visits. And I've had to put boundaries to say, like, I have my watch now, it will go off in 45 minutes to alert me that when I'm talking and I'm in my doctor mode and I'm in my chatting mode, that I have to like rein it in because I have to get going to the next person's house. And so
that would not be good for me.
Yeah.
I don't even know how you do it. Yeah, that would be
it was definitely an exploration of boundaries for sure, because I love my patients so much. It was just like, I had one lady who she had a lot of concerns that were back to back. And I was like, sure, I'll come over. And it was like, I thought it was going to take half an hour. I really thought it was, but
you've never done anything in a half hour.
Maybe a flu vaccine. But
Okay. You got me there.
Oh man. But yeah, I mean, I by nature am someone who's doing a podcast. I mean, I love talking to people. And so it's definitely been an exercise there, but learning exercise in terms of home visits are great for certain things. Like my patients who, they, because of whatever reason, age, physical status, mentation status, whatever it is, if they need a home visit, I still have the ability to do that service for them. But for the people who are like, I don't mind coming to the office, great, saves them money on doing home visits, because I do, after a certain point, charge an extra fee for home visits, but they can just come into the office. And so just like your own office, there's no fees every time they come into the office. In regards to, balancing the podcast and the kids, it definitely helps to have care involved. Like, it takes a village, absolutely. And for me, having school for Asher and having daycare for Nolan, it's definitely helped to free up time that I can really have a block of time to focus on things. I just need to maximize on that time, which I'm working on. That's where I feel I'm very, I hear you. That's where I feel I'm very much in a sophomoric stage rather than a freshman stage of all of this. Even though I've talked with so many physicians, it's like in my own practice, I still feel, yep, I am in year 2.
Right. Do you feel like you may end up putting some walls around your practice volume because you really are enjoying just that chance to talk and inspire other people, other physicians? I mean, even the time you spend on stage at Hint Summit, you're inspiring people on the podcast, on stage.
I have never been a full-time family physician after residency, nor do I intend to be, because I love doing this podcast. I love meeting people in person. I love being able to hang out with my kids and take them on vacation. Like we finally did that for the first time in 2.5 years. And Nolan went on his first plane ride. Yeah, Henry Dorley's is coming up, man. I swear. But Nolan went on his first plane ride. It was just such an awesome year. And because of the way that my clinic has grown and the way that I've been able to learn my barriers and learn that, I might not be at my barriers yet, or
you haven't defined them yet necessarily.
Yeah. But it helps me, I guess, get more clarity as to what boundaries I would be comfortable with. I do not envision my practice being, 800 strong. And I will say that, there are definitely days, it's not all sunshine, all lollipops and rainbows. I had the great privilege of attending one of Dr. Sharon George's retreats in Napa earlier this year. Oh, it was so awesome. And just, again, being in the space with DPC physicians is so, there's no word to fully describe that experience, right? And you and I totally know what that feels like. But I had the privilege of talking to other physicians, and I was privileged to hear stories where DPC is not the easiest thing all the time. And I'm 100%, I have had days absolutely where I'm on, at the point of the tears are going because I'm super overwhelmed. But just like Dr. Lauren Hughes shared in her reunion podcast with Dr. Munkor and Dr. Much, that when she starts feeling irritated with what she knows that normally she's not irritated with, she feels that that's her, I'm approaching a boundary. And for me, it's when I'm feeling stressed, when I'm feeling overwhelmed, I am very grateful to also have the space to say okay, we got to reevaluate what's going on here. And so that I couldn't have that in fee-for-service for sure. But all of the feels that I've experienced over the past year, that my family has been through the past year, it really has allowed me to say yep, I love doing the podcast. Absolutely want to grow the podcast audience, the podcast impact, but also I want to grow my clinic to what I can handle, and that where I can make impacts where I couldn't make them before, and be able to take care of people and be a mom and be an entrepreneur. And I have more tools under my belt in order to achieve those things.
You had mentioned something about adding on an extra fee if people have more than X, Y, and Z home visits. I mean, do you have that number set out, or is it based upon each patient individually, or how do you do that for the people that are performing home visits or want to do this and have a model similar to yours?
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
That's a great question. So prior to opening the office, everybody got 2 home visits a year that were intended to be, one was an acute, if somebody needed stitches, and one was an annual home visit. And so that was the per calendar year. And then on top of that, if somebody needed additional care at home, there was a fee for $100 plus, depending on how far you were from my location in Arnold. In terms of how the model is going to change, I'm currently working on, how to give as a very, very big thank you to my initial adopters, this continuation of like, I want to provide home visits for you guys, whether that's one, whether that's two, whether that's, I don't know how many. I'm still working on my pricing going into 2023. But in terms of the thankfulness, I want to show them thanks for believing in this practice and understanding the model and joining early on. And then beyond that, the people who join the practice as of 2023 and going into the future, it'll be a different structure. And I feel that my ability to just say like, yep, this is how it is, and not have the, oh, but I don't want to change the pricing, blah, blah. Like, I feel that by hearing other people's stories, I have a lot different confidence and assertiveness when it comes to changing prices, because that's how it is, because now I have a physical space and I have more options for care within the community, that I can do that. And I don't feel guilty about it.
Well, and you have more overhead now. So obviously you need to make that cost up for sure.
Yep.
What do you think about just procedures and having, if you do decide to stay with a smaller volume of patients, procedures and keeping all your skills up, thinking like procedure clinics, or kind of what you were mentioning with the circumcisions, doing things like that with dermatology and your skin IO and.
Exactly. Yep. So my ideal for keeping up my procedural skills is to offer procedures for the community. So whatever that need might be, I don't know what the need will be in terms of like, if the community college needs, a women's health day where they just need pap smears and people aren't able to come until these hours, like working with the community to figure out what's the need in terms of procedures. But yes, in terms of dermatology, in terms of circumcisions, those are absolutely in that arena of, to keep my skills up, I want to offer those services carved out of membership to the community.
Or, I mean, when you fly down to Nebraska to keep your skills up as well. I mean, just saying. Started, right?
Well, this is true. And for those listeners out there, Amber and I were talking about, how much does it cost to get malpractice and a license in the state of Nebraska? And how much does it cost for a ticket to fly out to Omaha? Mm-hmm. And it's absolutely doable. If there's, just like how John Jacobson flies to your clinic to do vasectomies, there's ways to make things happen. If you have the time to, and you truly want something to happen, there are ways to think out of the box to envision that thing happening, whatever it is. And so that could be procedures for some people, that could be obstetrical care for some people, that could be whatever it is. But, even the physicians who are frequently posting about like, I didn't do many XYZ procedure in residency. How do I learn these things? There's ways to learn procedures. There's ways to expand our knowledge in medicine all the time. And in this model, I've really found that, again, like with everything I've described, that you can do whatever you want.
Right.
Yeah.
No, I agree. That's true. Yeah. So with you serving your community in Arnold, we have Ashland, my hometown. So it's a little over 1,000 people. And then we're in Blair for 5,000. We have been able to add that same sort of medical care in Ashland. For years, they had a medical clinic and they always closed because it's a traditional clinic. They can't afford, they have high overhead, they aren't there long. So we foresee our DPC clinic staying there long term. And when we do that, then we're able to help anybody from people with insurance to without. But Ashland has a lot of blue collared community members. And so for them, a lot of them aren't getting care at all unless it's affordable. So we've been able to provide anything from urgent care visits to IV fluids to, biopsies. It's really neat being able to help farmers in the community and doing everything these small clinics do. But as you know, our clinics in Ashland and Blair, we provide a lot of different services and still offer prenatal care. And like you said, Dr. Jacobson will fly in and do vasectomies and sometimes drive, just depending on the weather. But it's been very eye-opening to be able to provide those and then grow, right? So we're getting ready to go on year 5, and we have 2 places here in Blair, and we have our clinic there in Ashland that we still drive down to once a week. Hopefully, getting to a point where we grow big enough in Ashland that we can add somebody there. So then they're more than just once per week, maybe even have our nurse there 5 days a week or a nurse there 5 days a week. Other than that, we spend a lot of our time here in Blair. There are a lot of people that seek care outside the traditional medical system and the hospital here, but also people that utilize both our hospital and our clinics. So we've just been really blessed to have grown as much as we have in the last few years here. But when you were here, I mean, obviously you got to see we're doing, PRP, PRF, we're doing OB care, we're vasectomies, IV fluids, biopsies. I mean, we keep everybody running. I mean, we probably see more patients per day than most DPC clinics do, but we have I'd say we're a little over 1,000 people in our practice now, but we also offer aesthetics. And like I said, quite a bit of like hormone therapy and consultations from that perspective. So we have people driving in from Omaha, people that drive in from out of state. So it's just really fun to keep just a large variety of medical care available at our clinics.
Yeah, absolutely. And yeah, I would say that, my 2 cents in terms of visiting another direct primary care physician's clinic or clinics in Amber's case, I definitely would say, go into it with an open mind in terms of you never know what you're going to see, and just think about, okay, in terms of my own practice, what of this practice can I learn from? And that's, down to like for your clinic, you guys were describing how there was some difficulty with patients saying, oh, but I didn't know I was paying cash for the labs versus using my insurance for the labs. And you have a very clear, like, my understanding is that I'm going to use my insurance, or my understanding is I'm going to pay cash for the labs. And that's a huge thing that I picked up on in terms of being able to, just like a consent form, like to say, like, this is how you're going to pay for your labs.
Yeah, we had to do that because it seemed as if no matter how many times we would explain to patients over and over, that this is the extra cost that's going to be on top of your membership fee, then they might say, oh, I didn't know that was going to happen. Or maybe we would tell them what it would cost for the labs, and then they would call back and say, oh, I had wanted to run that through insurance. And it just puts you in a hard spot with even your staff, because your staff is doing the right thing. You totally trust your staff. But it got to a point where it was happening too often, because people would say they want one thing when they're in here, and then they leave and they want another. So we just decided, like you said, we just made up a form that said, okay, I'm either choosing insurance or cash for labs, and we check it, they sign off, they get a copy, we get a copy. And we found that for the lab scenario was definitely something we wanted to do that on. And then we also show them our termination agreement when we have them sign a contract, because that was the other thing people really struggled with, is they wanted to call up on, say, the 2nd or something and terminate, but they are due to pay on the 5th. And so now here it's 3 days before they're due to pay and they want to cancel care. But then in a week from now, they're going to call and say, oh, can you refill something? I guess I forgot, I wanted this before I left. So we had them start signing a termination agreement too, that just, they understood that they were going to pay 30 days past the time that they signed that form or stated they wanted to terminate care. I mean, those are the 2 things we're pretty hard on in regards to, okay, sign off on this, know what you're signing, because these 2 policies will stick. They are there. And those are things you learn over 4 years being open.
Yeah. But I think that's great knowledge and experience that you share, and you've shared on top of what you've shared on the podcast before with our talk, and then also your initial interview. And I think that those are the things that it's like when you're at a person's clinic, when you're at like what they've envisioned and what they've created, it really allows you to just reflect on your own space in terms of if you have a future space, if you have a current space, and, in terms of like workflows, that's another thing, asking the staff, how do they do things? How do they set things up? And envisioning, like, do you have the same amount of staff? Do you envision yourself hiring staff? How would your workflows work? Thinking out those scenarios, it's just like having like an OSCE back in medical school. You're really like doing your own mental OSCE as to, okay, would this work? Do I like this? Oh, I want to bring that into my clinic. Wouldn't want to do that, whatever it is. But it makes you go through a mental activity that's very different than even hearing other people's stories. It's like, it does reach that to an extent, but seeing and like, the number of feet that it takes to walk from your exam room to your office, like I can envision that, and making efficiency or creating efficiency where it can be created based on a physical space. It's just very different when I feel when you look at somebody else's space. So I was super grateful to have that time that we spent together. And I loved also that like you've built this network of different vendors.
Yeah, just having different vendors for each different thing. I try and keep relationships I'm definitely tied to keeping those relationships that I've had originally, not expanding them too much, trying to use things efficiently. So I'm not having multiple orders from different places, but there are things that we just have a better connection with some of our reps with. And so we have like 3 and 4 places that we get different services from, but we also offer a lot of different services. So we don't just have our Henry Schein GPO, like you were mentioning, we have our custom pharmacies that we're getting things from too as well. And then like most people, they have their pharmaceutical reps coming by and But yeah, I really value relationships with those individuals. And that's how we've been able to have a successful clinic and grow. But man, definitely clinic flow and efficiency. That's something that we're always going back every day and really going through. We have our monthly staff meetings. We try and discuss what can we change, can we improve. Some of that we had to because we just grew so fast when Matt came on board, our PA, because now it wasn't just my patients, it was the patients he was growing and the panel too. So, I mean, we went from 2 nurses to now we have 4 and we have a receptionist and we have Matt, and that all grew in like a year. We had a clinic lead for a while and she's now no longer with us. So I definitely would say HR is a lot of work. That's the thing I think people underestimate. Even Dr. Lassie and I have talked about that before. It's like, wow, I'm drained from the amount of HR, just mental work that you have to do. And it's not always that it's bad HR. It's just that it's a lot of work trying to run the administration side of your clinic as well.
That's so true. And something that we haven't talked about is that I had a change in my own staffing. I was working with a particular virtual assistant company and I switched around August is when I started working with my new virtual assistant.
And all that time you have to, put into that.
It's like the pain of switching an EMR. I feel, thankfully I haven't had to do that yet, but for me, switching to a virtual assistant and figuring out, it was very eye-opening for me to really experience the difference between somebody who is not medically trained and somebody who is an RN, has been an RN for over, 10 years, bedside medicine, and able to understand things medically, or able to even have come from training specifically to be a medical virtual assistant. So I'm very, very blessed. Domelane is the virtual assistant who came on board as an RN in August. And it's been wonderful to be working with her in such a different way. But it's also made me think about the workflows and like literally rebuilding from the ground up different workflows, because what I found too often, my workflows, there's too many steps to them. And so for me, especially the way my brain works, that's again, going back to that sophomoric phase, I really feel it's like, okay, no matter how many stories I have listened to and how many people I've spoken with, man, going through it, it definitely, it helps. It helps immensely to have those stories and those lessons behind you. But then when you're actively dealing with how am I going to fix this situation in particular, then that, again, I'm very grateful for the freedom to then be able to harness my own, what will work for me, and then create, the new workflow or whatever it is. But that's something that affects the rate of growth or my comfort with wanting to onboard a certain number of people per month, because I don't want to, I don't like the feeling of like, oh, I needed that, so now I got to add that because it wasn't there before. But now that it's there, I don't have to go through that again. So, for example, I'd always wanted a drip sort of campaign in terms of how to use the practice. Dr. Donna Givens had sent me her example of what she would do for her practice. And she used a CRM that had some kind of like recycling of the content in terms of, every so many weeks, her patients would get an email about XYZ, whether that be like how to send prescription requests or whatever it is. But I really feel that those types of personalizations, especially built off of your workflows, can really continuously bring that value proposition and that relationship-based aspect of your practice to your patients. And repurposing content within your own CRM is a huge win. And it's a huge win for yourself in terms of future self. So that's one of the things that I'm working on going into year 2.
We just got, we're finishing year 4, and just probably 4 or 5 months ago, we sat down on a Friday afternoon for hours. And one of the nurses and I, Misty, she used to work with me back in the traditional system as well. And then Brooke, our receptionist, and anybody that had their hands in making any new forms, we sat there for hours and double checked that everyone had the updated copies that were going in the front box up front. And did I print off everything that I have? Because that's the other hard part, is that as you're creating these things throughout those years, you may have used one thing for a patient and then don't need it again for probably 5 months or something. And then you forgot that you made one. So you have to go back, and we had to sit there and customize all our content and make sure everybody's boxes and everything were up to date with the newest form, because not only are you maybe making things, you're also updating forms, or maybe your staff changes. I think for sure paperwork, and even just like any consents and things like that, that is the hardest part of just the administration HR side, because there's just so many moving pieces. And you also have people that have their own computers and, have their own inboxes of stuff, and just making sure people aren't hoarding things away, and you don't know what they have. So it's very nice to have just you being able to manage all that. But for people that are running micro practices, and it may just be you, like, that is the time to get all your ducks in a row, because when you're at my stage and you have all these staff people, right, and things have changed, you have to make sure that people are using the right paperwork and, just making sure everything's updated. So there are a lot of hands in the pot when you get this far. And I'd say that DPC graduation level of just going from that, like you said, freshman, sophomore, junior, senior, I mean, they really do change, which is why for the DPCA and the summit that we co-hosted with the AFP, why we were trying to make sure there, when we were planning the summit, Dr. Lassie and myself and a handful of the other docs, like Dr. Walsh, Dr. Forbush, and Purcell, we were like, okay, how can we strategize and make this for sure something right out of the gate? But don't forget about all these people that are trying to keep ducks in a row, right? And grow their practice, make sure they run their practice. There are just the different sides of business administration on that. But
absolutely. And the people choosing DPC already have this amazing ability to choose a different way that is not necessarily the mainstream yet. And so then having that support, not only online, but then through that, the strategic curriculum that you guys set forth for the summit was incredible. And I think that this year, especially with the track 1, 2, and 3, it was even more effective at getting that message out there that it's like, there are people who have experienced it all, and finding the people who are in similar stages to you, or being able to choose to look at and hear and see other people's experiences a couple years from where you are currently, it definitely, it's so powerful. And I mean, you and I, it goes back to that being in the same space as another DPC physician. It's like, you and I are definitely huge, how can we help you type of people, and whether that be patient care or DPC care, or DPC, inspiration when it comes to DPC itself, just being able to do this type of chat and just being able to see if there's anything that just be based on our experiences, being able to have it out there so other people can say like, oh, I can totally relate to that or learn from that. It's so great. And for those people who were in attendance, I would say one of the things to think about during the winter holidays or whatever, especially for those people with kids in school, is think about like making time, if you have not, to either watch for the first time or go back and rewatch those DPC Summit videos from the summit in Kansas City, especially because the recordings, you listen to them in March of a year, it will be very different than listening to them in June of the same year, because you might have added staff by that time or whatever. And so, it's you guys did a great job. And I will, encourage people to look out for the next dates of all the DPC summits out there coming up in 2023.
Yeah, I think we're just going to continue to just blow this free market out of the water. I look forward to where all the DPC physicians are going to take this in the years to come, because the passion that precedes all of this is huge. And that's what drives change, right? So I do think that all of us together are just going to make a huge difference. I've never seen people so motivated,
Absolutely. Absolutely. And what a reason to be motivated around, right?
That's right. That's right.
Yeah. So cool. So cool.
I absolutely love doing this year to year. This is our second year in a row to kind of catch up. And I feel like we need to do this sooner than later. A year is so much to try and cover, but just the progress from, last year to this year. And heck, I was 2 clinics open. Now I'm 3 clinics open, and I better not be 5 or 6 by the time we talk again next year. And you hopefully will have multiple episodes out by the end of next year when we chat again, unless we decide to make it sooner. But I appreciate you having me on again, Doctor, and peace out.
It's been a great season 2, and I am so looking forward to season 3. While waiting for season 3, check out our website at mydpcstory.com. And while you're there, pick up some DPC swag, check out the My DPC Story Mapper to find guests in particular areas around the country, and find helpful resources for anyone, no matter where they are in their DPC journey. In the meantime, also, please share the episodes with a physician you may know who needs to hear about DPC, and follow us on social media. Go ahead and also check out dpcnews.com for the latest happenings in the DPC movement. And happy holidays to everyone. And until next season, this is Maryal Concepcion.